Terminal weaning is removal of assisted ventilation from patients that will result in death. Patients that are terminally weaned are unable to ventilate on their own due to an injury or illness and will be ventilator dependent for the rest of their lives. Two methods of terminal weaning are removal of an endotracheal tube and ventilator altogether. It's called terminal extubation. Removal of the ventilator with the endotracheal tube still left in place is another method of terminal weaning, and it is to provide a patent airway and prevent airway collapse. This method is more preferred by family members that still remain at bedside. Withdrawal of life support can create an ethical dilemmas for respiratory therapists because we are trained to help and protect life, and terminal weaning does the opposite. Terminal weaning goes against everything that respiratory therapists are taught. Which is to provide for the patient's ventilatory and oxygenation needs at all costs. Another ethical dilemma is if the respiratory therapists have to choose between which life to save. For example, if there's a ventilator shortages out in the hospital, and there is a patient that is on prolonged ventilator support, and there is another patient coming to the emergency department that needs a ventilator and has a better chance of living, then the respiratory therapist will have to withdraw care from the prolonged ventilator assistant patient and use that ventilator for the other patient that just came into the emergency department. So that can cause a great ethical dilemma. For counseling and support, the respiratory department should have support for therapists that are affected by terminal weaning, and the respiratory therapist should reach out to other therapists that have been in the job field longer to see how they cope with terminal weaning and what helps them get through it. And this may be easier said than done, but try to leave the emotions out when you're working. Maybe that'll help.